Good morning. I'm Dr. Katie Brown, the CFS doc, and today I wanted to get your opinion about what I can do to set up the best chronic fatigue syndrome practice and clinic that I can. I am a chronic fatigue syndrome survivor, and I'm interested in treating other people with this condition. I'm a humble family doctor. I'm recently out of residency. I'm not a specialist, but I do know that there aren't enough specialists to go around for this condition. Those that exist have long wait lines, and there's just people who are desperate and who need help. So I'm doing my best to learn as much as I can, as fast as I can, and draw from what I've learned during my own fight against chronic fatigue syndrome. And I'm hoping that you all will share your stories with me as well, so that I can bring as many tools as I can to this clinic and help people out. So in this series, I'm going to kind of give a rundown of what I'm already thinking about, what I'm already considering trying, and then you can help me fill in the gaps. If there's something I'm not thinking about, please, let me know, reach out. I'm very open to differences of opinion, other suggestions, things that I haven't thought about. So, how I've structured my clinic overall is to start with a thorough collection of data. And this is going to look like a collection of a history, past medical history, a social history, and then extensive questionnaires to help me kind of narrow down these root causes so that I can be more pointed when I'm actually in front of the patient and taking an interview or doing a physical exam. The reason that I'm relying so much on the questionnaires, and they are quite extensive, is so that I can handle a larger volume of patients. I know that there's just so much need out there, and in order for me to help as many people as I can, I have to use my time very wisely. So I'm hoping that much of the time that might otherwise be spent asking the same questions over and over again, I can kind of gather that data more quickly through questionnaires. This is my cat, Richard. um, right, okay. Questionnaires. So these are quite extensive, almost to the point of being burdensome. I'm thinking about some ways that I can cut them down, get rid of some of the excess questions, things that are repeated. But eventually, I'm hoping to have a streamlined and not too intensive history taking process that is mostly um, done outside of the clinic. Then I go through and I review all these questionnaires, the patient's past medical records, and then I decide what things I still don't understand, where are the gaps, and then I do a 1 hour history. This can either be done in person in the clinic, which is located in Terre Haute, Indiana, or it can be done virtually, which I imagine most people are going to prefer. And then the other option is that I travel to the patient's home in order to do this interview. Um, if I do travel, then I'll want to do the interview and the physical exam in the same day, which I imagine could be quite exhausting. So I'm probably going to recommend that most people do the interview virtually, and then I can travel to see them for the physical exam. Hi, baby. He's he was hiding all of yesterday due to a thunderstorm, so he's just soaking up the love this morning. Okay, so once the interview is taken, I've done the physical exam, then this completes what I call phase 1, which is the data collection phase. And what I'll do is I'll take all that information that I've gathered and I'll make some recommendations as far as further diagnostic studies to run, further labs to do, maybe some specialists to refer to. And the whole point is to identify or rule out other things that, alternative diagnoses or even things that commonly come along with chronic fatigue syndrome that kind of point to root causes. So, for example, if I find that you have hypermobility and some signs of craniocervical instability, then I may recommend that you get some imaging and see a neurosurgeon. So, this is phase 1. Now we move on to phase 2. Phase 2 is the actual treatment side of things. And this can be done in 2 separate ways, um, as can the assessment portion. It's it's about how much support you need from me versus how much you're able to recruit your current medical team to help. So if you have a very supportive general practitioner who's willing to order the tests that I recommend and make the referrals that I recommend, then you can outsource her to them. I didn't realize my computer's been in the frame this whole time. I'm gonna close that. If you can outsource some of these things to your general practitioner, or if you have a rheumatologist or other specialist who's helping you out, um, then again, that takes the load off me so that I can spend more time with other chronic fatigue syndrome patients. It also keeps my prices down, which is another benefit to this model because I know many of the chronic fatigue syndrome specialists out there um, can be quite pricey. My general approach as far as ordering labs um, is to be more on the conservative side of things. That's always just kind of been my personality. And I'm very sensitive to the fact that many of the patients coming to see me, if they are still working, which many aren't, they're kind of coming to the point where they don't know if they'll be able to continue working. That's generally the point at which people become desperate enough to search for a specialist, and they've been sick long enough to know that um, their average doctor isn't going to be super useful. So I'm sensitive to the financial burden that we are under as people with chronic fatigue syndrome. And I'm not going to be running a whole extensive panel, such as some of the chronic, the more functional medicine minded practitioners might run. Um, Not to say that I don't use any functional medicine testing, it's just, it's something that I use judiciously. Um, and I'm still learning about which sorts of tests are useful and which are not. For phase 2 of the clinic, this is going to be the treatment phase. So I'll take all of the data that I've gathered from phase 1 and I'll make recommendations for things like lifestyle, diet, medication, supplements, therapies, and we'll try and come up with a treatment plan that works for you. I'm certainly happy to prescribe medications, um, but even better would be if I can make a recommendation and you can take it to your general practitioner and they can prescribe it. Again, that's cheaper for you and it frees me up to be more involved and have more patients. Now, I do want to also emphasize phase 3. Phase 3 is free, and I'm going to be doing it for all my patients as long as they're willing to. And phase 3 is my follow-up phase. So I've done all the work of gathering the data, making the treatment recommendations. Now I want to know if what I've done has worked for you. And I'm expecting that, for a subset of people, I'm not going to have the knowledge yet to know how to help them and what's going to get them better. And so I'm hoping to be able to follow up with these patients many times in specialty clinics or even in primary care clinics. If the doctor is not able to help, the patient moves on and the doctor never learns what they did wrong or what they could have done better. And I'm hoping that, every 6 months or so, we can have a brief email conversation or a brief face-to-face conversation virtually, and I can learn how you're doing, if anything else you've done has been helpful. And then I can share with you things that I've learned in the meantime. Maybe I've discovered a new root cause. For example, I've recently learned about nickel allergy and how nickel allergy can be a root cause of chronic fatigue-like symptoms. So I might recommend that you trial a nickel-free diet and see if that helps. And so we can kind of keep in touch, and you can continue to benefit from my knowledge as it grows. Because as of yet, I don't consider myself an expert. I'm just someone who's been there. I'm very passionate about this condition. I understand the intense suffering and loneliness that comes with having chronic fatigue syndrome, how difficult it can be to even get a diagnosis, much less find somebody who is knowledgeable and able to treat you and treat you in such a way that it's not going to make you worse and hopefully does some good. So I'm expecting to grow and learn through this process, and I would love for you to benefit from that as I do. So these follow-up appointments, they're not going to cost you anything. You've already paid me, and I'm hoping that at some point I can benefit you, even if it's not right away. Then again, if I do help you and you are improving, then I want to know things like, how long does it take you to fully go into remission? Do you relapse? If you relapse, do you have the skills and the tools to recover again? Why did you relapse? I want to understand if what I'm doing is actually helpful or if it's just kind of a short-term or partial solution. And I'm hoping over time that I will develop an expertise in this condition and be a useful resource for the chronic fatigue syndrome community. So if you're interested in becoming one of my first patients and really helping to mold how this clinic works, or if you're not within one of the states that I'm licensed in, I would still love to hear your story and learn what helped you. What did your particular subset of chronic fatigue syndrome look like? And where are you in your journey? Because every story helps me to learn. So please check out my website, cfsdoc.com, or you can email me at brown@gsdpc.com. You'll find that in the description. and I'll see you in the next one. Bye.